So getting upstream, what does that mean? To me, that means let's stamp out chronic disease before it starts. Let's help people with our Live Well programs. And this is not just physical stuff. This is spiritual, it's financial, it's stress reduction. I think we have quite a comprehensive program that we're bringing to our caregivers, and we think increasingly to the communities in which we serve. Now, maybe my least popular decision as a new CEO, right? I hear the chuckles, right? Was starting to reduce sugar in our facilities. So no more sugared pop, no more candy in our hospitals. And people can bring it in if they want. But let's be really clear. We know that 40 to 50% of chronic disease is based on behavior. And we know a lot of that behavior is around eating. And my wife can attest, I have a far from pristine diet, okay? So I am not perfect in this regard. But it felt wrong to me and to us to provide people with things that we just know aren't good for them. And again, if they choose to bring those foods into our facilities, more power to them. But we view this the same as selling people cigarettes in our hospitals. We would never do that. We also seek to support community initiatives from a physical activity, from an environmental health, and other standpoint. We believe in helping people manage their own health, and the My Health app now has about 10% of Utahns, or about 300,000 people who are signed up, and it's a beginning of helping people manage their own health care, look at their labs, reorder meds, make an appointment with their doctor, communicate with their provider, etc. We have 4 companies right now that we have gotten started based on the activities of Intermountain. The first is Inteleer, which is a supply chain group purchasing organization, aligned with that terrific result you saw for cost savings and the #1 supply chain in the United States. Accelera is a specialty pharmacy business. Navican Genomics came out of a clinical program in our Southwest region to help people with advanced cancer have their tumors sequenced and identify, if possible, less toxic therapies that would allow them to lead healthier and longer lives, and what turns out at a lower cost as well. We've turned that program, which actually serves 5 foreign countries already, in addition to Utah and the United States, into a company called Navican Genomics, and it's off to a great start, and I know some of their leadership is here today. And finally, Empiric Health is a company that's based on some transparency technology that we've created that allows clinicians to understand the cost basis of what they choose. Within our own system, in the last couple of years, we've saved about $100 million using this. We believe it'll be helpful to others as they seek to improve the cost basis of their care and be able to serve their patients in a more reasonable fashion. The Intermountain Chem Gardner Transformation Center is going to go up on the grounds of Intermountain Medical Center. It's going to house 3 different programs. First is Dr. Brent James' Advanced Training Program, which has now taught more than 5,000 leaders from 30 countries and 50 states the Intermountain way of doing quality improvement. It'll house our clinical programs, which I've talked a little bit about. And under the leadership of Dr. Charles Sorensen, who'll be the founding director, we'll have a new Intermountain Healthcare Leadership Institute, which will bring dyads, a physician and administrator, together from leading health systems around the world to spend time on a residential basis to learn how we drive quality, safety, patient experience, access, and stewardship. And one of the things I particularly like about what Dr. Sorensen envisions is, in addition to teaching the principles of leadership, he also is interested in the principles of leadership and how we can do the right thing and still be very successful in taking care of patients. Unbeknownst to us, a leading survey group tried to determine who were the innovation leaders in healthcare, and we were very pleased to be identified as the 5th most innovative organization in healthcare. What's particularly stunning is that increased by about 50% just over a 1-year period. So we really think the way we do things is gaining traction, and we're glad to participate in sharing that with others. To that end, for the first time, Intermountain was included in the World Economic Forum in Davos this past winter. So we were asked to be a governor at Davos on the healthcare track. Only one of 10 delivery systems worldwide that was asked to participate and to lead and to share. Why is that? It's all the things I said. Help people live the healthiest lives possible, be a model system, be accessible, be affordable, drive extraordinary care. You can expect for us to continue to take this aspect of our mission very, very seriously. Thought leadership. Some people said, Mark, why would you want to share this stuff? And my answer is always, there's no secret sauce. This is all about the execution, and we're all in this business together, regardless of whether we're working together formally or not. You may notice that a number of us have these One Intermountain pins on. So Intermountain has been an absolutely fabulous organization with lots of individual flavor and culture across our regions, and we don't want that to end. But what we must have is we must deliver on the promise to our patients that regardless of where they show up, if a procedure or a service is provided in more than one place, the quality is exactly the same. The experience is exactly the same, that we're consistent in delivering to them. They're trusting us, and we aim to live up to that trust.